my name is Emma Tribeck, and I am the graduate assistant for the UND Public Health Program. I am a first year 4+1 student pursuing my MPH, and welcome to our first episode of the UND Public Health Podcast. In this episode, we're going to be hearing from some alumni from the UND Master Public Health Program. We're just going to be hearing about their experience in the program and how they're utilizing the health disparities concentration in their current careers. And they're also going to give tips to students who are interested in maybe pursuing an MPH themselves. So without further ado, here is our first episode.
Yeah, cool. Hi everyone. My name is Stephen Price. I graduated the MPH program in 2018. So a little bit ago, I was actually the second cohort to ever go through the program. And then my background was at the time it was community health education. So transitioned straight into the master's program. I did the bridge program where my senior year was my first year of the MPH program. So I only had 5 years of schooling compared to the 6. We'll go into, I know we've got some questions, but I work for Optum. I'm a provider relations advocate. So a lot of healthcare, patient care, patient advocacy, all that good stuff. So we'll get into that later, but yeah, excited to be here.
Very cool. I saw you just jumped on, Madeline. We are just doing intros, so you didn't miss anything.
Awesome.
But I'll let Sean go next. He's next on my screen.
Alrighty, yeah. Hey everyone. My name is Sean Schweitzer. I graduated from the graduate program at UND in the MPH program in 2019. I work for the State Department of Health as a field staff in Fort Wayne, Indiana. Currently I've been working a lot with COVID stuff, as I'm sure a lot of you guys have, but I'm the public health preparedness coordinator for District 3.
Alrighty, I'll slide it over to you, Brendan.
Hi everybody, my name is Brendan Bostron. I graduated the MPH program at UND in 2017, so I was part of the first full cohort because I think the first one had like 2 folks. So I was part of the first full one. Let's see, so up till literally 3 weeks ago, I was at the State Department of Health Laboratory. I managed a few laboratories there, and then I'm in law school at IU McKinney currently. And I just switched over to the Attorney General at the state. So I'm in their licensing division right now. So we kind of help enforce complaints in terms of quite a few med malpractice complaints, things like that. Essentially anything in the state that you need a license for, it goes through there if there's complaints. So I do right now.
It's very cool to meet you, Brendan, because the profs always talk about you as their student who's in law school, but there's never like a face or a name to it. But they definitely, like, all the time, they're like, we have students who go everywhere. We have one in law school. And so it's very cool to see who's in law school. Madeline, I'll hand it to you next.
Awesome. Well, my name is Madeline Wilkes. I graduated my undergrad in public health at UND, and I worked 2 years as an ABA therapist after graduating, and then now I work at the Indiana State Health Department as a special health care coordinator with families that have children with special health care needs. So our program covers what Medicaid doesn't cover. And so I spend a lot of time reaching out to families to make sure that they're getting the care and the support that they need, and we give them resources if they need additional help. So, yeah.
It's very cool. Madeline, I don't know if you remember, but you probably don't because it was so long ago, but when I was a freshman, you and Sean actually both had spoken to some of my classes. And so both of you guys are a huge part of why, so cool. Yeah, just listening to you guys chat about it. It's a huge part of why I am where I am. So I just wanted to give you guys a shout out for that because those impressions definitely were super lasting for me, clearly.
Oh, we appreciate that, Sam.
Yeah.
All right, I will hand it over to Emma to run questions. Oh, and Madeline, like I told the other people on the call, super chill, like conversational. Feel free to jump off of what each other is saying. It doesn't have to be anything formal. We're kind of just going to take whatever comes out and slice it and put it together into the podcast, but it's just relaxed. So super, take it that way.
Okay, so this question's up for grabs, whoever wants to go first, but how did you make your way into the public health field?
So I'll go first, I guess. So I started off as exercise science, and Dr. W, I don't know if you guys, so you guys are familiar. I was totally lost. I hated my classes. And she was like, well, have you talked to like Dr. Rock? And I was like, I don't know who this lady is. And so I talked to her, and then I fell in love with public health. I was actually pre-OT at the time. And then I dropped my OT concentration because I fell in love with public health so much. And like, it just came like really easy to me. And then I always wanted to work in a health field somewhere. So when I got this job at the health department, I was ecstatic, and I love helping people, and I want to reach out to people and make an impact in their population.
And just to kind of piggyback off of that, I was kind of exactly in the same boat as Madeline. I started out as exercise science pre-PT. I just really couldn't get into the classes, and I didn't really even know public health was there, that it existed. And through, again, Dr. W, as well as some of the other students who are already in public health, they were like, well, you should check out this, this major. I'm like, all right, I will, and I looked it up and saw all the opportunities that you could have outside of college with it. And I'm like, I actually really kind of feel like this would be interesting. And from there, I just continued to learn and grow to love public health.
Yeah, I feel like there's a trend. I was also pre-OT and dropped it. I was always public health though, so not like exercise science or anything like that. And Dr. Rauch was my advisor for my whole time, even in the grad program, she was my advisor. So I knew her from the start, and she kind of got me hooked on it. And then obviously Dr. W, she got me interested in epidemiology. So then I kind of just started exploring it from there. But yeah, I would say I was always a part of the public health program, but I think that's where I guess a lot of people start is the OT or the PT, and then you kind of open the doors from there.
Awesome. Well, I'll break the trend. So I was certainly not that. I worked as a chemist for I don't know, probably 5 years after I graduated undergrad. I was a mass spec chemist, and I ran a laboratory. So I managed a lab after a couple years. And I truthfully wanted out of the laboratory, and I really wanted to do something like health policy based. And UIndy's program was great because it was something where I had looked around for public health, and obviously Fairbanks is typically the one folks go to, but that was a chance to do the hybrid program and still work, which was something huge for me, at least at the time. So I got into it that way. But again, that was pretty early in the program, so it hadn't even been, that was the first like full year, and they were pushing at that. So I think the turnaround time was, oh my gosh, I think I talked to the program in July, I think, and then next thing you know, I was off and running in August. So yeah.
I just want to say that I totally understand the Dr. W. She did the same thing to me my freshman year. But Brendan, I actually love that you talked a little bit about being a chemist. My sister's in the public health program now. She's a sophomore, but she's a public health and chemistry dual major and kind of trying to find her way between the two. So I might have to have her chat you up sometime.
Well, and it's interesting because like I picked it because I mean I was doing a forensic toxicology, so that's like cause of death. We were like, business was booming because obviously the opioid epidemic everybody knows so well about. I mean, unfortunately, it does great things for laboratories that test cause of death. So I mean, we saw a huge uptick in cases. And that's kind of why I picked it, truthfully. So yeah, she's not far off. It's not hard to get herself from where she is now to there. So
awesome. I too started off as an exercise science pre-PT, so there's a lot of parallels there. I think it's really great that we all found our way to the public health program, one way or another. So the second question that we have for you guys are, if you could change anything about your time in undergraduate or graduate school, what would you do?
I wouldn't have taken any OT classes. My GPA was way lower at the time, and I didn't know what I wanted to do with myself. So I was just kind of my parents had pushed OT onto me, and I mean I do love OT, but it was a big influence, and I just realized that I just didn't fit in with the anatomy classes, and so I wish I would have learned about public health instead of in the admissions office. The first thing that I was always told was exercise science, and I was like Sean said, I didn't even know that public health was there.
And I was told that public health was the food pyramid, and that was about it. So I was like, what? But yeah, I kind of just wish that just from the get-go, I would have had public health as my undergrad major instead of switching over second half of freshman year. I think it just would have been easier to get to know people even better and the professor more. So that was kind of a regret of mine.
Yeah, I guess to that point, I wouldn't change anything about my experience, but I wish I would have told more people about the program, because once you're in it, you just see how amazing it is and you meet all these connections. But I mean, even once you graduate, I don't even think my parents know what public health still is. So just, I guess, explaining more and getting more people involved, that's something that I wanted to do more, is recruit people.
And I mean, as everybody was saying, I truthfully, I don't know if I would, I'm with Stephen, I don't know if I would change anything, but surely I wish I would have started earlier. So I had milled around going back for a while. It sounds like everybody here for the most part was really quick from undergrad to graduate school. And I truthfully didn't know what I wanted to do. And what was nice is that this has such a, huge breadth in terms of what it covers. You can do so much with it. I wish I would have just pulled the trigger earlier, because it really is I'm sure everybody here has examples, but I mean, the projects I picked and the things I did while I was at UIndy were all things I wanted to do. So I was reaching out to the organizations, and you pick what you care about and you do projects for that, right? And you are helping people, which is really neat, because I mean, yeah, it's a school project, but I know for a few of the ones I did, for the organization, it's much more than a school project. It's something that's continued to help out. So I know I wish I would have done that earlier. But at the same time, I'm very happy about how it played out. So.
Yeah, so something that's really cool about the UIndy's program is that we have our concentration in health disparities. So can you guys speak to how the health disparities concentration has helped each of you in your careers?
So I work with families that have children with special healthcare needs, and there's a huge disparity in the care that they get and the treatment that they get just in general. I've learned a lot about what happens at the health department with additional funding going to other places, and I kind of feel like being at the back burner of things, and it's really hard when I want to sit here. I want to help all of these families, and it's there's not enough funding to add more families to our program. So there's a big disparity when it comes to that population in general, but that class has helped me find other resources to give the families that if we can't cover it, this is what I can provide you, go reach out to this organization, go reach out to this person, so that I can make an impact in other ways.
Yeah. And I'm kind of the exact opposite in that setting, to where I work with a lot of seniors. So I deal with a lot of patient care. So it's a lot of it's anybody, I guess, over the age of 65, but we also have individuals that are blind and disabled. We're opening it up to people that are in assisted living facilities. And then we're also trying to start coordinating with Hoosier Health Wise and then the Healthy Indiana plan. So starting to get into more younger populations. but kind of the same thing where you see like those older populations are, I guess, severely overlooked in types of the care that they need. So my role is to kind of help them like find transportation to doctor's appointments, get them in network with physicians or surgeons if they need any specific like patient care, and then ultimately get them over to, we have not only like our internal clinical team, but then we also work with all the different providers across the state. So basically just get them into the type of care that they need.
I'll go. I will say for sure that it doesn't happen too often for me, but it was ahead of the curve. Like realistically, this is everywhere now. I mean, it is a huge policy concern in anything you look at. Let that be like massive healthcare organizations at the state level. I mean, a great example is like COVID has made those disparities even worse. So we look at like, I was putting together, like my group was in charge of specific targeted testing kits for the state, because areas of Gary and lower SES areas were just outright not getting tested. So there was no idea the amount of virus in the population, right? And I mean, at that point, there's now, vaccine advertisements all over the place there, but these were things that are all part of what we learn about. And it really is ahead of the curve. I mean, I graduated in 2017, and that was something when you still spoke with people that a lot of people didn't, I mean, as you said, with public health in general, people didn't know what it was, right? But that's even worse with health disparities. People just assume, oh, it's tied to health insurance. And it is by no means that simple. And I know that for me, it's been huge, because everywhere I go and everywhere I've applied and moved forward with what I'm doing, there's always a need for that. And that seems to be like something that's continually showing up in missions for, I'll be at Roche this summer, and Roche has that in their mission. And it's something that is continually showing up places. And really UIndy was ahead of the curve. I mean, that's something that will continue to be like that. And I'm sure all of us, we know to put that down and being involved in understanding that better than most, it really will help.
Yeah, Brendan, I love what you said about that the healthcare isn't just tied to insurance, because so on my side, like I said, I work for Optum, but like not too many people, like they know what United Healthcare is, but when I talk to people, they have no idea what Optum is. Like maybe some people might know because Optum's like a pretty big pharmacy, like nationwide, but like we all roll up to United Health Group as our parent company. So like I'll work with the insurances, all the ones that are, I guess, available in Indiana, but then we have that clinical care side. So you go a lot deeper than just having health insurance, looking at like your copays and your deductibles and whatnot, and really hitting home like, okay, where you're at, what are your needs, and like how fast can we get you into that patient care?
Absolutely. Yeah. And I mean, an interesting thing too, from something that some of the programs currently going on like that some of the faculty here is involved in, is just finding a way to tie extra money at a state level to disparities, right? So a good example is like some of the housing at the state now has a health component that they factor into their budgeting, right? And that is what we know to be true and what we see and what we're studying. But I mean, that seems like a very foreign concept to people, right? So like, how can my housing affect my health negatively, right? But it turns out when you start tying those dollars in and making a business case around those, suddenly people start opening their eyes, and that's something they've had some success with. So that's something that like some of the programs here are starting to take advantage of, but it's something we all know about.
Yeah, absolutely.
I really love that you guys spoke to the breadth of disparity. I think a lot of times when we say disparity, we think racial and ethnic disparities, which are super incredibly important to address, but disparity is so much more. And there's so many populations impacted by it, whether it's those who are disabled in some way, or just tons of others. And so I really, really love that that's something that people outside the public health field are hopefully going to hear listening to this, is that disparity is so much more complex than we sometimes give it credit for right now.
Mhm.
Absolutely.
Yeah, thank you guys so much. That was such great insight for sure. And especially being a student in the program right now, hearing a professional talk about how important the disparities are, it really hits home for, I'm sure, Sam and myself as well. So we have a little less than 10 minutes left. So I think that one question that we want to ask for the listeners are, what are your pieces of advice that you would give to current public health students?
Network.
Yeah.
None other.
100%.
That was how I got my job. That's how I've talked to Dr. Box. I've talked to the state epidemiologist at my work, and I've trying to reach out to as many people as possible, because it's more about who you know, not what you know.
And also ask lots of questions, whether it's going through an internship, whether it's asking the professors, other students. I mean, there's never a dumb question that you can ask, because that question could be something that really helps facilitate your progress, and really helps overall with just learning more about the field and what you can do to better yourself.
Yeah, I would say with that, just to be ready to dive right in. Like, obviously you've got your interest once you find like your niche in public health, but I think everybody can agree, like, once you get in your position, like, you wear a lot of hats in the public health field. So yeah, well, I mean, like we just talked about with like people in law school, or like if you would have asked me, like, me being actually like with patient care, like I've always wanted to do something patient care related, but not anything like medical or bloody or anything like that. Like, I never would have imagined like I'd be able to actually open the door that I'm in now. So just be ready to kind of look at everything, and don't say no to any opportunity, and you'll never know where you end up. So yeah.
Yeah, that's what Dr. Box told me. Don't say no to any opportunities.
Yeah. 100%.
And I like what Sean said, which is don't be afraid to, ask some questions. The other thing too is, like, don't be afraid to, I know for me, don't be afraid to ask for help, right? I mean, you meet a lot of people doing what we're doing. You get to meet people through these organizations, and it really is something where once you're kind of involved with it, all of this stuff does interplay. And something that I know I did that has been extremely helpful for me is just simply being willing to ask questions, and then ask for help too. If you have something you want and you want to do, and some direction you want to go, odds are with connections, between the faculty here or even the folks we're talking to today. I mean, all of us, I'm sure you can make our emails available, or LinkedIn's a great thing too, obviously. But I mean, ask for help. I've found, like, in general, people are very, very helpful when they're involved in something that you both care about, and that they think, hey, I can help someone who in someday, can help me in return, or can even make what I'm doing more successful. So I know, like, for me, I reached out to the faculty when I was still deciding where I wanted to go after the MPH, and that was suggestions from the faculty at UIndy that helped me point in the direction I was going. And additionally, some students that are still involved in public health now. Like, I had a couple classmates I graduated with that were already at the state and helped me get on at the state initially. So, like I said, ask for help. Sean's right. I mean, don't be afraid. It's easier now to do it than ever. There's no sense in adding someone to your LinkedIn if you're just not going to take advantage of that stuff. So. Yeah,
definitely stay in touch with your professors. I mean, I know it's easier said than done. The one thing that I really enjoy is being able to just, after you get done with your program, connect with like Dr. Rauch and Dr. W and everybody on a personal level. And like Brendan said, it could be through LinkedIn or emails or whatnot. Like, I was thankful enough to have Dr. Rauch on my social media pages now. So just being able to have them not only in your back pocket, but then also get to know them on a personal level. I think that's a really valuable experience. It's something that you can continue to have after the MPH program. So it doesn't stop after all the assignments and the projects and whatever that they have you do.
It was really, really great hearing from you guys. Like, as someone currently in the program, this was a super engaging conversation for me. And it's really exciting because we hear stories about all of you all the time. I mean, our professors are bragging on you guys constantly. So just to put like stories and faces to that is it's really exciting for me, and I'm sure it's exciting for Emma too, and anyone else who listens to this in the future.
Yeah, thank you guys so much for coming to speak. I love that we were able to get a wide range of professions out there. It really speaks to all the unique things that you can do with public health. And we hope that you enjoyed it too. And yeah, like Sam said, this has been a very great conversation for someone who's currently in their first year of the program. It's very intense, but I know that it'll be worth it. So we thank you guys so much for your time.
So we just heard from a group of professionals who sat together in a question and answer format. And obviously there was a big group of them in there. And now we have one more professional that we're going to hear from, Erica from the Indiana Minority Health Coalition.
And I'm Erica, and I've worked with Sam before because she's interned where I work at the Indiana Minority Health Coalition. So that's how I know Sam. But yeah, I finished my MPH there at UND in 2018. So that was a good experience. So in one of the beginning cohorts, because I actually made mine a 3-year program. So I started in 2015. I think that might have been the 2nd year of the program ever going. So yeah.
Awesome, nice to meet you. We can just start with the questions. So how did you make your way to the public health field?
Well, to be quite honest, I didn't really know what public health was. I think there might be a lot of people like that. I didn't have that as an option in my undergrad or really ever heard of that as a program. But I was working at UND as an advisor, and I saw it being one of the offered graduate programs. And I went to an open house, and it sounded amazing. I learned about the wide scope of the field, that it focuses more on disease prevention rather than treatment, more of a holistic approach in terms of looking at all the ways our health and well-being is affected. And that's when I knew it was like a right fit for me, because that just really aligned with my belief system and how I like to approach health in general.
Erica, I had no clue that you used to be an advisor at UND. That's so cool.
Yes,
I just know you. I just know you as I know you now.
I worked in CASA. I did not work with the public health or health promotion students. I was kind of all over the place, but yes, I was there and I wanted to get my graduate degree and was just kind of searching through the different options, and public health just luckily fell on my lap.
Yeah, so cool.
That's funny that you mentioned that you didn't know really what public health was, because I think that was a pretty common theme in the last session as well. And then for me personally too, because I started off as a different major and transferred my major. So I think that that's pretty common.
Yeah, I was pre-AT when I came in, and I was looking at what major, because I was pre-AT fast track, and I was looking what majors you could do with it. And I think it was like public health, exercise science, and chemistry. I looked at, or biology or something. Well, I looked at chemistry, biology, and exercise science and said, no, thank you. And I mean, just chose public health because I knew the other 3 of those, there was no way you were getting me into that.
I can understand that. I'm right with you there.
Yes, I think we all had similar paths, which is kind of funny. So moving on to our second question for you, Erica. If you could change anything about your time in undergraduate or graduate school, what would you do?
Oh man, I feel like I would change a lot. Especially I'd say in my undergrad. By the time I was in my graduate degree, let's see, the 8 years had elapsed since I finished my undergrad. So I feel like I was a little more mature, a little focused. Not saying that's everybody's experience, but for my undergrad, there's definitely a lot more I wish I had retained. And so like studying in a way that I want to learn it for long term rather than I want to do well on this test. That may have been a lot of people's experience, but that would be one thing. But also, I would say more important in both, mainly with my undergraduate, I would have done more internships. I would say more intentional internships, and sought more applied experiences. I went to Notre Dame for my undergrad, and I didn't really have an understanding of what I should be doing, like with internships or jobs. So I found myself just trying to get jobs on campus that really weren't like career oriented or gonna help me in any real sense, is like, you know, having a job at the library or just different jobs like that. But I wish I'd been a little bit more intentional with that. Those applied experiences are really priceless. The one-on-one job training that's received. So uh, as far as like with my graduate degree, I was already like mid-career in a different field and had professional experience. But because it was a different area than what I do now in public health, I see how just having that internship in public health makes such a difference once you're starting that career. So basically, I just wish I'd sought more diverse experiences in my undergrad. Maybe I would not have spent so many years doing something I was not passionate about prior to finding public health. So just being a lot more intentional about that.
I really, really, really love that you spoke to like being intentional about it, because when we introduced our new freshman this year, one of the first things I had a freshman ask me was, well, how do I start getting an internship this summer? And I was like, this summer, you've barely like, you're not going to know anything yet by this summer. I mean, you're just going to have like raised the top. And I think there's just this temptation now, and it's just with how the world's working, is just to add these experiences, to add them and not to, you know, get the true value out of them. So I really think that that's a super important message, you know. And one of the things that I voiced was, yeah, internships are great, but you have to start somewhere, you know. You need to do some volunteering for free and build up that resume before you can really even be competitive in the internship field, because that is a competitive field just in the way the job field is.
Yeah, absolutely. That's so true. And not just taking, I think even for instance, like where I work, I notice, and it's okay. I understand sometimes students, especially undergrad students, may not know exactly what sort of internship they want. They may find an organization, so they're not exactly sure. But I do find that as I look at intern applicants, we are more excited or interested in those students who have an area that they want to explore a little bit more deeply, rather than, you know, we have different departments. Let's just say, you know, we have research and programs and policy and different areas. So when we get an applicant and they're like, I want an internship in all these areas, I'm interested in everything, it's hard to really know kind of where to place them, what they're, you know, how we can use their strengths or what we can help develop. So yes, I would say really trying to, you know, being intentional about seeking those experiences.
Yeah, that's definitely really good insight, because like Sam was saying, there's a lot of pressure to do as many things as you can, and while that can be good and getting involved in lots of things is super great for networking and other purposes, it's also good to narrow down your scope and, you know, stay within your limits a little bit and give all that you have to just a few things rather than spreading yourself too thin.
Absolutely.
So yeah, could you explain to us like what you currently do for work?
Yeah, I guess that would be helpful. So I work at the Indiana Minority Health Coalition. We are a statewide organization. We have, I believe 22 or 23, I can't remember, but like local coalition affiliates throughout the state. So that is how we just have this amazing network, very unique. There's nothing else like that really in the country that has this network of minority health organizations. So we are go-to a lot of times when people are trying to decrease health disparities in Indiana. You know, we partner with the state and also local departments of health, and just really everyone kind of comes to us because they want to make sure that racial and ethnic minorities are at the table. An organization that is ran by, and also like the board of directors filled with people of color. So the input, we're hearing from the communities themselves on how to address the disparity. So we're definitely increasingly being brought to the table, especially as health disparities are like it's more in the spotlight nowadays than it was even just 5 years ago, especially with COVID. So I work there at the Indiana Minority Health Coalition. My title is now Director of Special Projects and Marketing Manager. So I'm kind of like split. That is way different than what I was just doing at the beginning of the year, where I was working in public policy. So that, I mean, sometimes there's just a demand, and a lot of things keep changing in public health, and they kind of see your skill set and they put you somewhere else. So I'm glad to be able to continue to develop and grow in this public health field.
Erica, I totally agree with the fact that people want you guys at the table. Just even comparing my freshman year and interacting with organizations then to all the organizations I interact with now, I mean, you guys are name dropped left and right. I mean, I hear the Indiana Minority Health Coalition in tons and tons of conversations that I have with organizations that are addressing, I mean, any issue that you can think of. So your guys' work it's definitely being noticed across the state. And I mean, you're definitely acting as an incredible resource for so many organizations who are hoping to address health disparities as more and more the importance of them is coming to light.
Exactly. Well, thank you for that. That's so good to hear. So although we're realizing it because our work is increasing here at the central office, it's good to hear that others, even public health students, are hearing about IMHC and the work that we're doing. So thank you for that feedback.
Yeah, so this next question will be a nice segue because you kind of touched on it a little bit, but how has UND's health disparities concentration helped you out in your career?
It's helped tremendously. Reducing health disparities in Indiana is literally the mission of the organization I work for. So the health disparities concentration really laid the foundation for the work that I do. It gave me that frame of thinking. It helped me to understand how addressing social determinants of health it's critical to addressing health disparities. So it makes sense when my organization wants to focus on addressing economic justice, racial justice, environmental justice issues, education reform, just everything. Some people might say, why are you involved in that? You're a public health organization. But having the health disparities concentration, the public health degree from UND really framed all of that. So I'm able to properly explain the connection there and how it's all connected, and it provided basically just the big picture needed to do the meaningful work in public health.
That's definitely so great to hear, especially as a student in the program. Just hearing the feedback from the professionals about the importance of the health disparities and seeing it come to life in your careers has been really great for me, and I'm sure Sam as well.
Right. I don't think, like, I just want to add, like, you can't talk about public health. Like, that's one of the biggest parts in public health is health disparity. So just that being the concentration and really like digging deeper into what causes those health disparities, like in in the different classes that are offered at UND, it makes it so much easier to have these conversations. Even as you're working with other organizations, you just see the tremendous benefit of having that concentration.
So this question kind of ties into the last one, but for you specifically, in what ways do you see health disparities impacting the populations that you see and that you work with?
Oh man, it affects all aspects of the work that we do. As Sam knows, when she was interning with us at one point, we focus a lot on maternal and child health issues, and obviously there's tons of disparities in that realm, but also chronic health conditions. So, just anything that has measurable health outcomes, you see how it's impacting the populations, that the racial and ethnic groups across the state. And we primarily, like here in Indiana, our biggest groups are obviously Black and Latino groups. So yeah, we definitely see these health disparities affecting our minority populations throughout the entire state. Here in Indianapolis to Fort Wayne to Gary to Evansville to like all of the major cities where you're going to find, and even some of the rural areas where you have larger Latinx populations and how they're being impacted. I mean, and also how even the health disparities that we're seeing with COVID, the death rates, and everything, we've seen how it's really disproportionately impacted Black and Brown community. So, I mean, we see it in everything. So that's the work that we do is we do a lot of advocacy, we do a lot of education, but we do a lot with our local coalitions around the state who directly work with these communities.
I need to give a quick shout out to Erica because she mentioned my internship. I mean, Erica took me on not knowing anything about policy. I had not taken a single policy course yet. And I mean, she introduced me to a lot of it, and it's something that I have really loved exploring. I mean, I spoke on it at a state conference just yesterday about how policy has changed amidst COVID and during COVID-19. I'm done with big words, but how COVID-19 has changed policy, and I just want to give you credit because a huge part of why it's become something that I'm really interested in has been that internship with you, where you, like I said, you took a chance on someone who knew very little about policy at the time.
Well, you did great. I mean, once you know you learn the foundation and you have the passion for it, then I mean we all do it. But also, especially in public health, as you all may have learned, that like that is one of the responsibilities of a public health professional, is to be involved in advocacy work, and that often involves policy work. So no, you did great, and we were happy to have you.
Awesome. So I didn't know that you did an internship with the IMHC, Sam. That's awesome. So we have one final question for you, and that is, what piece of advice would you give to current public health students?
Oh, I would say that, I mean, there is something in public health for everyone. I remember when I first started the program, and you kind of go around and people are like, well, what do you think? You have to figure out what area, because it's such a broad discipline that you may want to eventually pursue. And so you may not know at first, but there is a niche for everyone in public health. And so I would say just really try exploring that, as Samantha had said, like even if that's volunteering or just seeking out different public health professionals, maybe who've been on this podcast, or your program director can maybe connect you with some people or different organizations they know, just to talk with them and pick their brain and find out what they're doing. But just basically explore and find out what you can, and try to figure out that area that's for you. Maybe it's research and epidemiology, or health education and programs, or diversity and health equity training. There's really so many things. I didn't think I would be doing marketing or working a lot on grant projects. So it's so many. There's such a demand for so many different disciplines within public health, and I don't think that anyone will think, if you're going into public health and you're concerned about that, I basically am just saying I don't think you should be, because there's something for everyone. And then also, I guess I just want to say one more thing. Building relationships and collaborating between departments with other organizations is how everything gets done in public health. So I would say really make sure that you're focusing on your communication skills and building those sort of that skill set up, because it's very rare that you're working in a silo in public health. Like these relationships will always be happening, will continue. You're done with one project, another one starting up. So yeah, build those communication skills and networking skills.
Thank you, Erica. That was absolutely fantastic. It was so good to see you. I know we email sometimes, but I feel like I haven't seen you in a hot minute.
Yes, it's been a while. Now I'm in my dark garage, so sorry, my lights keep going off. But it is so great to see you too, and nice to meet you, Emma.
Yeah, it was so great meeting you too. Thank you for making time to come and talk to us.
Oh, no problem. This was fun. Anytime. So I'm sure I'll be talking with you ladies again.
Alrighty, enjoy your evening.
Okay, thanks. You too. Bye-bye.